Meanwhile, the United Kingdom has become the epicentre of Europe's COVID-19 outbreak once again, and Prime Minister Boris Johnson's Conservative government is currently facing immense criticism and anger from the people over its handling of the pandemic. Remember, the crisis facing Britain this winter is depressingly familiar. Hospitals have become overwhelmed and are to their capacity, filled to their capacity. Renewed lockdowns and also stay-at-home orders have also been brought back again, and Britain, economically, has again come to a standstill. Authorities have been blaming the new coronavirus variant for the recent spike in cases, and the ongoing crisis has sparked huge discontent amongst the masses. And critics say that Johnson's government's slow response in handling the crisis in the first phase of the pandemic has escalated the outbreak. More than 3 million people in the United Kingdom have already tested positive for the coronavirus, and over 81,000 have also died. The economy has shrunk by about 8%, and more than 800,000 jobs in Britain have been lost due to the COVID-19 lockdowns. Now, thousands of workers have also been furloughed and are presently in a state of limbo. Now, amidst the rising criticism, Britain has announced some steps to try up the mass vaccination speed. The country is to open 7 mass vaccination centres from today that will join 1,000 other healthcare facilities across the country. Thousands of people in England aged 80 or above have received invitations to get their coronavirus vaccines administered, and officials have said as of Sunday that Britain is ramping up its national vaccination programme in a bid to meet its target of inoculating at least about 14 million people by the middle of February. Healthcare workers on Saturday have said that they are feeling pretty hopeful that the centre will help the country, which is grappling with a surge of cases.
No, vitally important. It's the way that we'll hopefully be able to get through the different numbers. So, as I've already said, the GP surgeries and the acute hubs have already started this fantastic work. But really, to be able to get through the numbers and really start going through those different cohorts and getting as many people as vaccinated as possible, we need more and more sites.
Now, England has gone into its third nationwide lockdown last week with an order for the public to stay at home unless they need to leave the house for essential reasons, such as shopping or for other essential work. The officials are hoping that a pretty speedy mass vaccination rollout will help get Britain out of its third national lockdown, which was brought in to try curb the surge in the number of infections.